so who can benefit from compounding? Of course, tonight we're going to be talking about bioidentical hormones. So patients that need bioidentical hormones, typically to receive most bioidentical hormones, they usually have to be compounded. There are formulations that are available commercially that do use some forms of bioidentical hormones, but in general, to have it customized for each specific patient, it should be compounded. Pediatric and geriatric patients, I mentioned how many children are unable to swallow or may not like the taste of the medication. We can reformulate that. And for geriatric patients, I actually had a patient that came in several years ago, and he was taking an 8 milligram tablet. He was a 90-year-old patient, and he was given an 8 milligram tablet, and his doctor said, you need 1 milligram of this drug. The only strength that it came in was 8 milligrams. So this gentleman was cutting up one pill, and it wasn't a big pill. He was cutting up one pill 8 different ways, and really never achieving, never getting the exact dose that he needed. So we were able to reformulate that. We talked about pain management. Dermatology, this is one of the areas, probably one of the fastest growing areas in our pharmacy right now, because there's many patients that are now asking for cosmetics and wrinkle creams and skin lightening creams to be compounded for them, specifically for their skin type and for their situation. So we can compound preparations for dermatology, patients with specific disease states. I mean, we've worked with patients with multiple sclerosis. We do a lot of work for autistic patients as well. And one thing a lot of people don't think of is veterinary medicine, because have any of you ever owned a cat before? Okay, so cat owners, you know that it is very, very difficult to medicate a cat. If you try it, you're usually going to end up with some scratches on your arm. I wish, actually, the only time I ever had to medicate a cat was before I was in pharmacy school. And I just remember just the scratches, and you walk in the house and your cat hates you because he knows you're just going to medicate him at that point. So for feline patients, we've taken medication that they usually would take orally, and we've been able to put that into a gel that can be rubbed on the inside flap of the ear, and the medication actually gets absorbed through their skin. But it doesn't just work for cats. We work with dogs. We compound for, we actually just got a call today from the San Diego Zoo because they had an elephant that needed a medication that was really bitter, and they wanted us to make it in a non-bitter formulation. We've worked with most of the whales at SeaWorld, all the penguins there. So basically anyone or anything that has a medication problem, we can usually help out. So if you know of patients that are, we need medication. Many of us need for chronic diseases or acute conditions. Many times we're going to need to be medicated. And if those medicines are causing more problems than they're solving, contact a compounding pharmacist, and we can actually let you know what your options are. And once we find the options for you, we can contact your physician and work together with your physician to solve those problems. Okay? So let's talk about hormone replacement. And someone asked, well, what makes hormone replacement bioidentical? And what makes hormone replacement synthetic? It's very important that you understand the difference between those two, and that you understand the difference between the word bioidentical and natural. Because Premarin, for example, most of you have heard of Premarin or Prempro. We consider that a synthetic hormone, but it is natural. It comes from nature. Any of you know where Premarin comes from? Yes. Or what it stands for?
It's horse's urine.
Horse's urine. It actually stands for
That's why I wouldn't take it.
Yeah. The word stands for pregnant mare's urine. That's how they came up with the word Premarin. So it's synthetic regarding, your body does not contain some of the estrogens that are found in that Premarin tablet. But it's natural. I mean, horse urine is natural. It comes from nature, but it is not natural to your body. So, a lot of the older books that deal with bioidentical hormones, the term that was used back then was natural, but then we realized that that wasn't really specific enough. So the term that's being used now is bioidentical. And what bioidentical means is that it is like 100% identical to the hormones produced in your body. So your body produces progesterone. When you go to a compounding pharmacy to receive progesterone, that progesterone you're receiving is chemically identical to what you have in your body. And that's what makes it bioidentical, that the chemical structure is 100% identical to what's in your body. Okay? Synthetic hormones are patented traditional hormone therapy, usually made up of what are called conjugated estrogens and progestins. I really want you to focus on the word progestins, because progestins are synthetic forms of progesterone. They're hormones that have been made in the lab that are made to mimic some of the effects of the progesterone in your body. They are chemically altered forms of the original plant or human form of the chemical. So your body makes one chemical, and what certain drug companies have done is they've taken that drug, they've chemically altered it so that it still has an effect in the body, but at that time when they chemically alter it, they're able to patent it. And you have to understand, for a drug company to make money on a preparation, they have to be able to patent that preparation to make it their own. And that makes sense. You know, these companies spend, I think the average now to put a drug on the market is anywhere from $400 to $600 million that a drug company has to spend to take a drug to market. And when they do that, only 20% of those drugs are actually profitable for them. So they want to make sure that they're not going to produce something that another company is then going to replicate. When a drug company has a patent, that patent lasts for 17 years from the time they submit the patent. And then after that, you'll find that other drug companies can come and make copies of that drug, which we call generics. So with synthetic hormones, they are chemically altered forms of the human hormones found in the body. So progesterone is found in the body. Medroxyprogesterone, which is what is found in Prempro, the synthetic form, that is synthetic. That's not identical to what's found in the body. Medroxyprogesterone, that form of progesterone in Prempro, does have some of the positive effects of progesterone in the body, but most of the effects are actually the opposite of what progesterone produces in the body. So if you were to look at the side effects caused by medroxyprogesterone, many of those are actually things that natural progesterone can help you with. So there are major differences between the two. I mean, one example is in pregnancy. We many times will be called on by physicians to make progesterone injections or progesterone suppositories for patients that are having problems with their pregnancy or have had miscarriages in the past due to low progesterone. We have to give those patients bioidentical progesterone. If we were to give them medroxyprogesterone, it would cause a lot of problems with their pregnancy, and in many cases it would basically terminate the pregnancy. So you can see, although one drug was meant to copy another, they are not identical. They are